One of the things that really sort of sparked my interest in research in self care and midwifery was when I was actually, for a few years, acting as the president for the American College of Nurse Midwives Maryland affiliate. And on a fairly regular basis at meetings, midwives would approach me, and sometimes they would be very stressed out, and they would say things to me like, "I think I made a mistake going into this profession," or "I don't think I can do this anymore." And that sort of sparked my interest in trying to find out what can we do. We need more midwives in the world. All the studies are showing that, globally speaking, and so that sort of sparked my interest in engaging in research in this area. So, resilience is actually a very interesting word, and it's something that's being discussed a lot in the literature these days, globally in places like New Zealand, Australia, the UK. And what we're finding is that there are some things that make midwives more resilient than others. Positive relationships with the women they're caring for, with their coworkers, self care activities are high on the list. Also, a collaborative workspace. And this is a systemic issue that is worldwide and different everywhere you go. Some of the things that midwives find very stressful are things like work overload, hours, their environment, the political environment around midwifery, and their scopes of practice. Resilience is one of the words that we want to be very, very mindful of and how we use it, because in some ways it can be interpreted as the ability to sort of toughen up and handle anything that comes our way, rather than it being just simply faced with a difficult situation and finding the tools to make this a workable environment until a long-term solution can be found. So ideally, it would be wonderful if institutions or workplaces had these sorts of programs. And actually, this is where the physicians are taking the lead in the US in response to a lot of discussion about physician suicide. So there are many institutions that are incorporating this. You see it really more in the trauma settings than you do the obstetric settings, but there are some programs that exist. Some personal self-care activities that have been shown in the literature to be very effective, specifically in the midwifery community, are things like mindfulness practices, such as mindfulness-based stress reduction programs, for example, or really any kind of mindfulness training. So, a lot of the barriers that have been discussed in the literature are things like time, other demands on the midwives, either by their patients or their colleagues or their work environment, or trying to feel like they're also giving as much to their families or their other people in their lives that are important to them. This all becomes a barrier to self care. Also, being on call or working around the clock can prevent midwives who maybe want to be in a group environment or a more structured self care activity. That can become a barrier for them as well. So again, the one thing that's really being studied in the literature at this point in time is mindfulness practices. We do see other self-care activities like restorative yoga or meditation that are also very, very effective. And there are some institutions around the world that are looking into incorporating this through sometimes their integrative medicine cohorts and departments, if they exist within the institution. So that can be something that can be very, very helpful, and we're looking forward to learning more about how that's working for them. So it's very interesting because the sources of stress for students are often very different than the practicing midwife or the practicing nurse. However, a lot of it is the same. For example, student nurse midwives also are present at what we call traumatic births. So births with difficult outcomes or can be very, very stressful. And a lot of times we don't find ourselves debriefing with students as much as they need, and as much as we need, to be able to prepare them for what to expect in practice. So these are things that we need to be mindful of. Also, things like preceptor relationships, and trying to find their place in the setting that they're working, rather than be in sort of a no man's land where they're expected to learn all these skills, but yet they're not really considered part of a team by some institutions, different in others, in which they're considered an incredibly valuable part of the team and they're depended on. So there's a lot that goes into why we find midwifery students are stressed out, but the same type of self-care activities actually can be just as helpful. And the acknowledgement that this is present for them as well.